And welcome to Valley Talk. And of course, it is time for Skin Talk. We have our good friends from Silver Falls Dermatology here. It is the second Thursday of the month, and Dr. John Young is here. And you know what? Once again, back on the microphone is Cajun Joe.
I'm here.
I'm here. Hey, love your accent, and I missed you. Glad you're back here on Skin Talk with us today.
Yeah, well, before we get started, I want to warn everybody out there listening about Dr. Young. He lived in South Mississippi when Katrina hit. He went to Hawaii, got hit with the tsunami. Last year we were in Boston, and on the October 31st, Boston had never had more than an inch of snow in October in their history. It took 8 inches that day. And then this year he was up in the Northeast when Sandy hit. So, I think there's a petition going around the state asking him to move right now.
Well, the thing is, I try to purge all the storms out before I come back home to Oregon.
Well, I hope, did you leave Sandy back in the East Coast?
Oh, yeah. The nor'easter, too. It kind of finished the job there.
Yeah, it didn't try to follow you back here.
Oh, no, just a little bit of rain coming.
So where were you when Sandy hit? Tell us your story.
So we were visiting my son, who goes to school out in the Northeast, and we were in Boston and between Boston and New Hampshire, and we saw the storm coming, and all of the locals said, oh, well, it's never going to come here. It's not going to curve in. It's going to curve out to the sea, and the media is just blowing this up, and they sure were. I mean, it was plastered all over. I'm sure it was big here, but I mean, every other story there was on the storm path, and when it started looking like it was turning in, we knew we were in trouble because there were threats of flight cancellations. And not only that, but we didn't know if it was going to hit where we were. And we had a hotel right on the water in Boston Harbor, as they call it, Boston Harbor. And so we were a bit worried. We were on a high floor, and, if the electricity goes out, that's a lot of stair climbing with a 7-year-old attached to your hip.
Are we there yet?
But in fact, I was on the phone with someone from Silver Falls Dermatology in downstairs eating, and they said, how's the storm? And I was watching the storm from the restaurant there, and I said, oh, it's really not that bad. I enjoy watching bad weather because I grew up in New Orleans, and if you don't have a bad storm, then you're not living there.
Yeah.
So we were watching the weather, and all of a sudden the door behind me blew up because of the wind pressure. It just shattered. It just shattered and blew into 1,000 pieces, and that was right when I was on the phone with someone from Silver Falls. She heard an explosion. I said, I've got to go. And after time in the military, I was worried about terrorism and other things, but then we felt the wind blowing in, and we knew it was just the weather causing havoc. So,
wow,
it was akin to a story that Cajun Joe has from Las Vegas. And we all know what goes on in Vegas stays in Vegas, but
including the storms.
That's right. They cleaned up that splatter, that glass, shattered glass all over the floor within 5 minutes. I mean, I went to go take a picture so I could show people here, and it was all cleaned up. And that's like when Joe visited Vegas a few years ago. Someone shot himself.
At the bar. He was about 20, 30 feet away, and I'm playing the machine. All of a sudden, I hear pow, and I look over there, and a guy rolls off the bar stool on the ground, and the paramedics come. They put a sheet over him, take him out the door, and I kind of went to bed and went down there about 8 o'clock the next morning. They had new furniture. They had new carpet. I don't even know. They might have had new people. I don't know. But, I mean, it was like it never happened.
Wow.
So the fact that they had cleaned that up quickly just reminded me of Joe's story about the suicide at the bar that was quickly cleaned up. So it's... But bad weather sure has followed us around. Growing up in New Orleans, we lived through hurricanes. As we got older, they evacuated us more, and then we were there on the Redneck Riviera, is what we called it, Biloxi, Mississippi, when Katrina came through. And I thought I was done with storms, and we went to Hawaii, and we had to evacuate our hotel room because of that tsunami that happened back when that earthquake hit that caused all the havoc in Japan. And then now we got the hurricane, the freak hurricane on the East Coast. So,
but no matter how bad the storm looks, we can make you look good with our therapy, with our new treatment.
There you
How's
go.
that for a lead-in?
There you go. Yeah, you're sporting a beard now. You decide you lost your razor, or the razor was...
So, I went with only so much charge on the razor when I was there, and then because I was delayed getting back home, it started getting a little furry on the face, and I just decided to leave it. It's a good story. It's my hurricane beard. And I heard it's big in November anyway. Here they call it Movember, right? The beard growing season. So
there you go. Well, let's talk about Silver Falls Dermatology. I'm glad you made it back from the storm.
Thanks.
And thanks for sharing the story with us. Over here, it was huge news, big news all over the place.
Wow.
Sandy.
Yeah, it's hard to believe that we don't get extreme weather here because, my whole life I've dealt with extreme weather. And so it's always nice to think that we can get jazzed up about it from afar, but not have to actually deal with it and live through it here. But things are going very well here. We have our 2 new doctors, Dr. Marcus and Dr. Mon, and they're doing very well. The patients love them, and they're just working so hard. And Dr. Marcus is the one that's been the trailblazer with this new treatment that we have, the ultrasound facelift treatment. In fact, we sent out a flyer. We had an event last month for that new ultrasound piece of equipment to demonstrate it to the public, and we had so many people call to book at that event that we had to basically close the event within a day or two.
Really?
So it's really, really hot on all the news shows. It's been on Good Morning America.
Mm-hmm. Now, is that your wife out there in the lobby?
No.
Okay. Because she was in here. She was in here.
Two shows ago.
Few shows ago, and she experienced the alt therapy, and that was the first show that we were doing video.
Yeah.
And the video's still on YouTube if people want to see it.
Yeah, I've seen it. I had the procedure done.
Did you?
Yeah, and it's tightened up underneath my chin quite a bit, but I'm 68, and people tell me I don't look a day over 67 and a half.
There you go.
We're shooting for 66. One more treatment.
So the alt therapy is not just for women.
No.
In fact, I had it done. A lot of our providers are getting it done. It really mystifies a lot of the plastic surgery kind of hang up that a lot of people have, because most people don't want to look like they had a procedure done. They don't want to take time off to get a procedure done, especially guys. They don't want to be perceived as going in to get a plastic surgery procedure. But the neat thing about this Ulthera treatment is you can come in and walk out an hour and a half later and look a few years younger right off the bat, and it doesn't look like you've had any procedure done. And it's all outpatient, no numbing medicine, no shots, just minor discomfort, and it's just the results are amazing. For instance, at our event, we treated just half of the face of a demonstration patient, and we had her walk around, and you could see half of her face was pulled up tight and higher, and her chin was more well defined. The looseness in the neck was pulled up, and that was half the face. And so it was kind of an interesting, bizarre look to see the before and after just side by side right there.
Wow.
And of course, we did finish her other half up. So. And
So,
I think we have Dr. Marcus
Dr.
coming
Marcus
in.
is
He'll
here.
talk more about that. But go ahead.
Now the question is: it just for the face, or can you mention your chin? But a lot of people, especially as you get older, a lot of women have the flabby right under the arm here, right under the bicep.
Yeah, the really interesting thing
Tricep.
about this treatment is it's aimed at tissue called fascia, and fascia is everywhere in the body. It's deep underneath the fat of your skin, and so basically we can tighten fascia anywhere, which makes the possibilities of what we can treat endless. So it's been shown to pull up chest and tighten up chest, loose skin, and laxity. And when they did a study on this in Asia, and it's actually been approved in Asia for a breast lift, but when they did chest treatments in Asia, they noticed that women's breasts were lifted. So you can actually get a chest lift or a breast lift with the machine. You can get the bat wings, is what we call it, the hangy upper arms, the back of the arms.
That's what I was talking
that
about.
a lot
yeah.
of us get. Yeah, you can tighten that up with it. You can also tighten loose skin of the abdomen with it as well, which we haven't done yet, but we're looking forward to trying it there. A lot of women have a little looseness around the knee, right above the knee. They have like almost a little fat pad that hangs over the knee, and it's been shown to work for that as well. And then one of the things that we're not advertising that it does, but I've been caught looking at the study on my computer screen, is it does a butt lift. but it's hard to explain to your staff as they're walking by that you're actually reading a study, in today's paranoia environment about internet security. So no virus was downloaded. It was a true study that we were looking at in the office. So
no virus was downloaded and looking at this study.
That's right.
No animals were harmed.
No animals, neither were doctors.
I'll let Dr. Marcus say hello and tell people what his experience with the Ulthera has been.
You bet.
Go ahead and pull that mic a little bit closer to you.
Yeah, so my name's Dr. Marcus, and as Dr. Young mentioned, I'm certified and have done quite a few of these procedures with the Ultherapy machine. And to me, it's a great machine because it's kind of where technology meets the body's own natural responses. It's more of a natural way to go about getting a facelift because you're using your body's own mechanism, targeting the fascia, causing that injury. But then the body's response to that injury is to tighten, number one, and promote new collagen growth. So it's a two-step process there. The results I've seen doing it, we get a result right after. And then, the real result comes, as Dr. Young mentioned, 6 months down the road. And the interesting thing is I actually, draw lines on the people's face to mark, where I'm doing the procedure. We want to, of course, stay away from certain things such as bones and nerves, which we can see on the ultrasound that makes it nice. And I can actually see a difference while I'm doing the procedure. I actually see these lines move up, get a better definition in the cheekbones, and kind of see that, under the neck, that crepiness that people get actually kind of suck up in and tighten as I'm doing the procedure. So it's a really neat experience, really gratifying for both me and the patients.
And Dr. Young was mentioning that you'd had some kind of public demonstration and you actually had an overwhelming response. As we look at the YouTube video that we posted on our show from September 13th, we've had 81 views on it.
Wow.
So there's been a lot of people that are interested in it and going and watching it. A lot of interest from the public.
Yeah, definitely. Well, I mean, if you go get a facelift, you're dealing, one, with general anesthesia, which can be dangerous on its own. Number two, a big surgical procedure, which can have a lot of side effects. And so a lot of people, don't want to go under the general anesthesia, go under the big surgery, and this is a nice natural alternative to that. The results are a little more subtle, but the patients have been very satisfied. And if you go on the internet and even look at this procedure, because before I got into this and had my name on it, I wanted to make sure if that this was something that had real results that people were liking, and it has a very high approval rating, one of the highest of any of the cosmetic procedures around. And like I said, it's non-invasive.
Yeah, we had such a good turnout for the night that we did the demonstrations that we on January 24th, we're going to have a night out at the Creekside Country Club, and we'll be advertising on that shortly. And we're going to bring in the reps from all of our beauty enhancement type procedures that we do and products that we have.
Are you going to have the machine there? No?
I'm not sure yet
well,
what they've arranged,
but it's about the size of a laptop.
It'd be nice to do a demonstration treatment there, and we're going to be offering special package discounts and things like that. So it'll be a lot of fun, and hopefully we'll be able to treat some people there and let people see firsthand what the things look like and what they do.
Okay, when is that once again?
It'll be January 24th.
What time and place?
It's going to be like 6 to 10 in the evening. But if anyone's interested, they just call the office. The local number here is 541-967-8385.
And our main number?
And our main number is 866-599-DERM. And I've been off for 3 months. I got to be retrained.
So, Dr. Marcus, this has got to be satisfying for you as a dermatologist to see such a successful treatment out there and able to help people quickly and without the invasive surgery.
Yeah, it's great. I'm a big technology person, so I love getting my hands on new gadgets and things. So, and I'm kind of skeptical myself. So when I first saw this machine, it almost sounds a little too good to be true. And you see the before and after pictures, but seeing it in person and the patient satisfaction, it's very satisfying. Another nice part about it is people return to work within an hour after getting it done. So it's minimal downtime and great results. So it's
what about people that
satisfying.
have lost a lot of weight and have that flabby like around the middle section? Maybe they've let's say they've had an illness or a surgery, and so they've lost a lot of weight quickly, and so they have those folds, those weight folds. Does this help in
I
that
think
area?
that's a good point in that, seeing is believing. And so if you have too much laxity, then maybe you're not the right person for the treatment. We can probably get some tightening there. So it would depend on what the goals would be, So we'll usually be able to tell when we evaluate the patient what their realistic, expectations could be. If you're very old, the treatment still works, but you might not get the same kind of results that a person in their 60s would get if you're like close to 90, So it just depends on what your baseline is as to what we can kind of project you'll get out of the treatment. And then, surgery is always a good option, but it'll, immediately take off a lot of the loose skin. But a lot of the patients that have that are older and don't want to go through the surgery, the risk, and then the downtime. And a lot of our patients are on blood thinners and a lot of other medicines, and there's no contraindication to this Ulthera treatment with those. So it's nice in a patient who might be high risk for surgery or other things, they can just come in and get zapped with the ultrasound and get an immediate gratifying result without worrying about anything happening to their health.
Yeah, immediate is really, because like I said, it has been done to me, and as soon as you finish with it, I could puff out my cheeks and feel how much tighter it was on the side of my face. It's pretty amazing.
Cool. Now, what we're going to do when we post the MP3 of this on our website, we'll put a link on our website to the video that we shot.
Oh, great.
September 13th, and repost it again to KGAL.com, and so people can see what your wife looked like. And she was a very attractive lady, still is. We don't have it before, but we definitely have an after. And it did make her look, considerably younger. I guessed her age, which is always dangerous for guys to do.
That was a risk right there. I was
The next worst thing to that is when your wife says, "Does this make me look fat?" do not under any circumstances answer that question. There is no good answer.
Well, and don't hesitate. And you say, "No, dear."
But
you look fine.
But a big important point about like cosmetic procedures, and
Right.
a lot of people are interested in these. They see a lot of the radio advertisement or the TV advertisements locally and nationally, and everything always looks great. But there's a lot of snake oil out there, and so what we try to do is we try to offer things that really do work, and this is one of the nicest things we offer, because not only does it work long term, but immediate gratification is there. And so just about, everyone we've done so far sees immediate results, which is nice, and then we know they're going to only get better with time.
Yeah, would you rather go to an experienced dermatologist or some guy on late night TV saying, "Wait, there's more"?
Wait, there's more. Now, this is called Ultherapy.
Right.
How readily accessible is this? Are you the only dermatology clinic here in the Mid-Willamette Valley with this procedure?
Some people in Portland are doing it, and then we're the only providers of this between Portland and Medford. So there's no one else anywhere locally. And since we're new with it, we're offering a lot of special pricing and discounts, because we'd rather have people out there looking good and being real advertising for us. And so we're discounted substantially below like the other practices that are doing it locally, and it's been well received.
And if you want pricing information, just call the office.
Sure. And we'd like to do an evaluation. Evaluations are complimentary, because we want to make sure that we have the right expectations and can take a look and kind of tell people what we think that they would benefit from. The other interesting thing that it does, besides just a neck and face tightening, is women often try to recreate a curve of the eyebrow, especially laterally. And even with our older patients, not only do they care about that curve in the eyebrow, but they have a little sagging of the eyelids, which is often bothersome, and it's associated with an aged look and a more tired look. And this also does what's called a brow lift. So we can tighten the tissue above the eyebrow up, and it pulls the eyebrow up and gives it a more natural, cosmetic, pretty arch, and it also pulls the eyelid skin up. So it's kind of a nice thing for people who don't have eyelids hanging down over their eyes, because if it's really bad, then you probably need to get it cut off with a procedure by an ophthalmologist. But if you just wanted to lift that lid up a little bit and get a nice arch to the eyebrow, this machine does that as well.
I think it's probably, I'm not a physician or a dermatologist, but I would think that since this is more of a natural method and you're not doing a lot of super skin tightening, we've all seen pictures and videos of stars that look like they've had a facelift.
Yeah.
But this is so gradual and again, as Dr. Marcus was saying, utilizes some of the natural abilities of the skin to heal itself, that you don't have that super stretched look, correct?
Yeah, we
Yeah,
can't
that's
give you the Joan Rivers look. If that's what you're looking for, you head on down to Hollywood. But if you want to just look better, come see us.
Okay, what's the phone number once again?
So the toll-free number.
Toll-free number is 866-599-DERM, and the local number is 541-967-8385, and we are Silver Falls Dermatology.
Okay, you just heard from Cajun Joe. In the studio with us today is Dr. John Young and Dr. Brandon Marcus here. This is Skin Talk, and we've been talking about alt therapy. When we come back from the break, we'll be talking about some other...
We'll talk about lips, and we'll talk about some other cosmetic procedures, and then we'll head off into some sun damage-related issues and questions that have come up lately.
Okay, more on Skin Talk in just a moment. This is Valley Talk, and a very good day to you. It is the second Thursday of the month, and that means, as always, it is time for Skin Talk. The good folks from Silver Falls Dermatology, and we've been talking about alt therapy and the way that you can, using the procedure, do a more of a natural facelift and skin lift. And very interesting. If you have any questions about that, give the good folks a call at Silver Falls Dermatology. Dr. John Young, next on the agenda. What are we talking about?
Yeah, one thing that we noticed at our Ulthera event that we had last month was a lot of interest in other types of cosmetic things. A lot of people had questions about fillers, which are injectable things that help to make wrinkles go away, especially the groove around between the mouth and the cheek and around the chin. And we also do that. The new fillers are much better than the old ones. The old ones would only last about 6 months. The new ones last about a year. And they're about the same price. So basically you're getting it like a 2-for-1 deal with the newer fillers. And a lot of them have numbing medicine mixed in with them so they don't hurt as much. And they're derived from natural, they're made to mimic your natural substance in your skin called hyaluronic acid. A lot of them are paradigmed after that. So it's a natural thing. It's not an artificial type of substance necessarily, like a foreign body type of material. Mm-hmm. The other thing, a lot of women like to get their lips injected. And we do that, but not a lot. We don't like to have people have big, huge, unnatural looking lips. And the interesting thing about the Ulthera is that when we did my wife's demo, which she was the first one we ever did, they said, hey, do you want us to give her a lip lift? And I said, what are you talking about? And we said, sure, go ahead. And she kind of gave me the deer in the headlights look. Well, we zapped her lip, and immediately it turned her lip up just a tad, and it made it look like she had a little bit of filler injected in the lip. And it wasn't overdone, it wasn't unnatural. It just recreated a younger, more beautiful looking lip with more shape. And so that was pretty interesting. So I just wanted to let people know that not only can you get like a brow and a facelift, but it can also make the lips look a little younger and smoother.
And we do want to thank your wife for allowing us to do the video.
Yeah, she loved it, and she enjoyed being here a couple months ago, and doesn't mind talking about it at all. She'll probably make a return appearance at some point. And then the other thing that's been going down in the office, for whatever reason, a lot of the medical assistants have gotten chemical peels. So if you see people that look like they've been burned in my office, they've actually gotten chemical peels, and they'll look much better in about a week. So I don't know what, maybe they're trying to look good for Christmas, but we do that kind of thing too, and it's really safe, and it can often not only tighten and freshen up the skin, but get a lot of the freckles and damage off.
So but a lot of the stuff is nice and cosmetic, but everyone has to remember that our main job is medicine. That's what we do, and that's what we do best. So other stuff is...
it's a small percent of what we do, and it's fun, and it's nice to offer things that work, but the vast majority of what we do is, skin disease, skin cancer, acne, warts, the regular dermatology, rashes, and those types of things.
We're not heading to become a medical spa or anything like that.
Okay.
We just offer a few nice things that work.
But there are women that might really enjoy this alt therapy.
Yes.
And obviously there's definitely interest in it. Let's talk about some of the more medical aspects, like we were talking about precancerous growths. We've had I was just speaking about it before we went on the program today. This summer, we've had a beautiful summer. Rather dry, but a lot of sunshine. This last summer here in the Mid-Willamette Valley. And sun is beautiful and it's nice and warm. but in excess, it can cause some problems, can it?
Yeah, and it's often a delayed response. So people go out and have fun in the sun when they're younger, and it might be 20, 30, 40 years before the signs of damage from that really start to build up, and then often require treatment, whether it's precancerous or cancerous. And a kind of a bridge between the cosmetic end and the medical treatment end, are treatments that are good for both. So that's kind of one of the fun things we do, is we can often talk to the patients who have these damaged spots and pick a treatment that not only will help the damage, but also makes their skin look better, healthier, and smoother in general. And so we can augment treatments with chemical peels, which normally we do strictly for cosmetic basis, but we can do that in addition to some like different creams that treat precancerous lesions. And then we can also use treatments such as light treatments or creams that not only kill damage but tend to make the skin look smoother and nicer as well.
And here we go again. That's another procedure that I've had on my face, the blue light. Sometimes I think I'm the crash dummy for this whole practice, but we do quite a few things.
You do look pretty good, Joe.
Well, I'm very light skinned, and with the blue eyes, and so I'm a good candidate, because in my generation, we didn't use anything on our skin. You just went outside and you got burned, and that was the way it was. When you got burned, you stayed inside until the burn got better, and you went outside again.
Yeah.
But it has done a really good job on my face. It peels off all the precancerous stuff and everything, and leaves you with pretty nice looking skin.
Now Dr. John, we've been talking about the peels.
Mm-hmm.
That sounds painful. Describe that? What is that?
So there are different levels of peels. It's where you basically put a chemical on the skin and induce a little bit of damage, and then the damaged skin would peel off.
Kind of like a sunburn.
Kind of like that, but you're
Similar.
you're treating. Yeah, you're not exposing them to something that's damaging that way. It's actually damaging the superficial part of the skin, but not the deep part. And there are different levels of peels. So some of them don't sting or burn at all, and we call those like the lunch peels. So you can get those done, and you really don't look that red or bad. You can go right back to work, put your makeup on, and those don't give you quite as much bang up front. But if you do a series of those, you can get similar responses that you might get to just one harder peel. And so what we like to do is we start with some we might start people who are a little nervous about it on the superficial ones, but then some people just want to go right to the harder one, and we can go to that. And there are different levels of what's called medium depth peels or even superficial peels, and some of them will make you red for a few days, and some of them will make you red for a week or 10 days. And in general, the redder you are for the longer period of time is probably going to be associated with a harder peel, but you get more results out of that. But it does require at least not really downtime, but you might look a little funny in public. And so it depends on your comfort level with yourself and kind of what you do. If you work at a desk all day long, it's not as big of a deal. But if you're giving speeches and talks all day long, then you might want to not look like you've had a bad sunburn for about a week.
Speaking of sunburns, again, we had a lot of sun, thankfully, in the Mid-Willamette Valley this summer. You were mentioning it sometimes takes 20, 30, sometimes longer for the damage to show up. If people are concerned and say, boy, I really spent a lot of time out in the sun this last summer here in the Mid-Willamette Valley, can I come in and just have you do a checkup, and is that a good idea?
Yeah, absolutely. And the funny thing about us is we have so many fair-skinned people in Oregon, many more than I expected when I moved here, that we routinely get people in to get their skin checked or their spots checked, or they might have had a mom or a dad with skin cancer. Mm-hmm. And, a lot of times they'll come in worried about one spot, and that'll be okay, but we might find 5 other ones that aren't.
Dr. Marcus?
Yeah, I mean, and the key thing is here, a lot of people growing up back in the day, sunscreen wasn't around, wasn't used. You just kind of went out and played in the sun.
Or is it very low SPF?
Yeah, you didn't worry about it. And now we're seeing these people, like Dr. Young mentioned, 20, 30, 40 years later, that now they're starting to get the signs and symptoms. And the key part of this is to catching it early with any cancer. If we can kind of catch it, at its early phase or as a pre-cancer, we have a lot better treatments that are less invasive that we can do to stop it from turning into a full-grown cancer. Because once it gets into a cancer and gets a large size, then surgery is usually the best option. So we try to get people in early to kind of treat it before it turns into that nasty cancer, to hopefully avoid the surgery and keep the procedures down.
I will never forget one time I was in a dermatology clinic over on the other side of the state, and there was an older couple in the cubicle. I think you've heard me share this story before. And the dermatologist was talking to the wife, the older lady, about her husband. Well, we're concerned because there's this a small cancerous lesion on his face, and we need to take it off. And she was worried about the cost, and she said, well, he's led a good life, and it's just a little cancer, so it's not that bad of a deal. And I thought he was going to jump down her throat, because he said, lady, you don't understand just how serious this is. That skin cancer can be really, really bad and very, very painful, and it's not something you want to just ignore and just poo-poo away.
Mm-hmm.
Correct?
Yeah, no, that's exactly correct. And that's, again, why we like to get people in, as early as possible, and then regularly keep up with them and check up on it and treat them early, so that we can avoid the big procedures, as much pain and discomfort from the patient as possible, and hopefully avoid that and get it treated and stay on top of it.
Mm-hmm. Because the key to cancer, preventing cancer successfully, is catching it early and small.
That's right.
And that's skin cancer and any other kind of cancer. That's why you want the checkups and so on and so forth, skin cancer and other parts of our bodies.
And just like it's easy to blow off the fact that you had some sun damage early in life and you don't put it together with it being such a bad risk later in life, when you have these early forms of skin cancer, or milder skin cancers like basal cell or squamous cell carcinoma, they usually don't kill people. They're usually pretty minor and can be fixed pretty easily. However, if they do get in your body, they're extremely, extremely difficult to treat, and it can be a miserable way to go. So, it can fool you in that it doesn't seem like such a big deal, but if it goes inside, it is a very, very big deal. Now, the flip is true for melanoma. Melanoma is one of the ones that it's not as common as the other cancers, but once it goes deep, it has it's a much worse prognosis. But the problem with melanoma is it does tend to be more aggressive and have a higher rate of spreading than the other forms of skin cancer. And we see melanomas pretty routinely, and the scary thing is that a lot of them we find on people that don't come in for that spot. And so just to give people an idea, we might catch a melanoma every week or so, sometimes every couple of weeks. We might see 5 or more skin cancers, regular skin cancers a day, and we probably see 200 to 300 precancerous spots a day, at least.
Mm-hmm. 200 to 300 a day
Mm-hmm.
in all the patients you see.
Mm-hmm.
So it's something we want to check out and have checked up on.
Right. And when you do this for long enough, it's just like if you go to a good mechanic, they kind of have a feel for what they're doing. When you do nothing but skin for a while, you get a good feel for what things are good and what things are bad and what you need to do to help the patient. And so, that's what we enjoy about what we do, is we're really focused on that, and we can often just have a look and either put people at ease or tell them, something needs to be done and give them the treatment options.
When we come back, we're going to talk about what you can look for on your skin. Not that we want you to do an extensive self-diagnosis, but you can see some early signs of maybe some skin conditions you need to be aware of and have come in and have a deeper look taken at it. And that's another information here on Skin Talk with the good folks from Silver Falls Dermatology when we come back on Skin Talk in just a moment. This is Skin Talk, and welcome once again. And for the next 12 minutes or so, we're going to be talking to the doctors here with Silver Falls Dermatology, Dr. John Young. Dr. Brandon Marcus is with us, and it's good to have Cajun Joe back on the mic. I missed your accent there.
I've been working on my accent. I think I'm losing it a little bit.
Well, I hope you go find it, because I like accents. I work with voices. This is radio, so
Okay.
we like to have the accent.
Yeah, when I was in Boston, they have some great accent
bet.
going there. Boston Haba.
Yeah, well, a lot of people think I'm from Boston. Probably 50% of the people in Oregon that's made a guess. They tell me Boston. I actually had a kid one time tell me, says, "I know where you're from. You sound just like my dad."
You need to wear
your dad from?
You need to wear Yankees
Said Boston.
stuff more.
No, not even close.
You don't hit him, do you?
No.
Oh, okay.
No.
Not anymore.
I'm pretty passive.
Not anymore.
That's right.
Hey, before the break, we said we were going to tell people some signs to look for. We spend some time talking about the dangers of sun and too much sun exposure and what that could do to your skin. What signs can we possibly look for indications to just, the layman about
Right.
things I need to be concerned
Right.
about?
Well, the easiest thing to remember is if you have a new or a changing mole, that we should probably take a look at that. A bleeding mole or something with an itch or just some sense that you have that things are different or not right is a good reason to come in. We used to not think that was a good reason if you just had a sense that things weren't right, or if you had some complaint about a spot. But the recent research shows that people do have kind of a sixth sense when something's going wrong with their body. And for instance, we had a gentleman who had a huge skin cancer in the last couple of weeks on his body. I mean, just an enormous one, the size of a softball. And we cut that out, and we were talking with him, and he said, for years he had been complaining to his doctor about that spot not feeling right. And
did it itch, or did you
it itched and it bothered him, and he just felt like something wasn't right with that spot. And because he had what's called psoriasis, which is a rash where you're covered with red and scaly stuff, he thought that the doctor thought, well, that's just part of the psoriasis, but it ended up being a huge skin cancer. So his suspicion was verified when we did the biopsy. It certainly was a bad spot, and he should trust those instincts. And sometimes you need to get another opinion, if you're really worried about something, or you need to tell the doctor, hey, go ahead and test it.
Well, one of the great things about Dr. Young's organization is we have doctors that are totally dedicated to just looking for these things, and they do it day in and day out. They have nothing else to distract them. And then we have our own Dr. Lear, who does the Mohs surgery when they do have something significant. It has to come off, and again, that's all he does all day long, and believe me, he is the best. But, they don't cross over into each other's fields. They don't do a little bit of clinic, a little bit of Mohs, that kind of stuff. One guy does all the surgery, everybody else does all the medical part.
Okay. Let's talk about the gentleman that had the very large kind of softball-sized lesion or cancerous part on his skin. As you allow it to grow, there's a danger more of it going deep and spreading, isn't it?
Yeah. So it kind of makes sense. The longer it's there, the more risky it is of going into the body. The bigger it is, the more risk that it's going deeper or getting into the body. So those are all more worrisome signs. So that's why when you cut that out, you go a little deeper and a little wider than normal, and then you test it to make sure that you get it all out. But yeah, we have farmers sometimes that we see that have had a skin cancer chewing off their nose for 20 years, and you just wonder how they didn't come in. But those are the type that can go down into the bone, into the nerves. They can get into the brain. They can get into the eye socket. It does happen. It's uncommon, but it does happen, and the risk of that's higher with something that's been there for longer. Besides a changing mole, the other thing that we want people to worry about is a spot that's bleeding or ulcerating, scabbing up, or a new scaly spot somewhere, particularly where they've had sun damage. So if you get a new spot, on a face, head, and neck, and the head and neck is where most of our skin cancers arise from anyway. So somewhere in the sun-exposed regions, if something doesn't quite heal or comes and goes, often that's a sign of a precancerous lesion. And if we can nip that in the bud, we can save people a lot of grief and scarring. And it's a lot cheaper to treat it when it's earlier than later, which would make sense.
Yeah, it's much smaller than Dr. Marcus. Anything you want to add here?
Well, I would just bring up the point as well that Dr. Young mentioned earlier. Probably, I'd say close to half the cancers we find are on people that came in for something else. They came in for a rash or for dry skin or just a visit for something else. And, we're really thorough on our exams. And I'd say about half the cancers we catch, people had no idea that they had. A few weeks ago, we caught one in a guy's ear, and he didn't know it was there. And unfortunately, it had grown and invaded pretty deep, and he required a radiation therapy. If he had seen us earlier, we may have been able to prevent it before it got to that point. But the point is, he's not looking inside of his ear, as most people don't, so he had no idea it was there. But that's why it's really important for people to get in early, so we can do a baseline check, kind of see where they're at, and then keep up on it.
That's a good point, because one of the things that people have mentioned to me when they, family members and whatever, when they go to a dermatologist and you have to take off all your clothes and you're very thorough in your exams. I mean, between the toes and in other areas we're not going to mention on the radio. And some people are, kind of sensitive to that kind of thoroughness, but that's important, isn't it? To be thorough.
Yeah, it's very important. And, we're professional here. We do have female providers as well, because everybody has their own comfort levels and barriers. And like I said, we're very professional, but at the same time, in our minds, it's important to do a thorough exam to make sure that we're not missing anything and missing any cancers when the patient leaves our building.
Because a cancer in the pelvic area or the ear or between the toes can still kill you.
Exactly.
It's a good point that in those embarrassing regions, that's a big part of our business, and we treat and diagnose a lot of things in those areas, and so a lot of people come in actually sent from their gynecologist to see us, because often we know more about the superficial stuff in that area than the other people, and so often either urologist or gynecologist will get our opinion on something. So it's not something people should be embarrassed about. It's a big part of what we do, and we like to catch things and treat them early to save people from damage in any region.
Okay, we need to take one more break on Skin Talk, and we'll be right back. And it is Skin Talk today. We do want to mark your calendar on the second Thursday of every month. We talk to the good folks from Silver Falls Dermatology. Usually Dr. John Young is here. Dr. John Young, thanks for being with us today.
Yeah, great to be here.
And like to hear your stories about the hurricane. I'm glad you survived. The beard looks nice, by the way.
Oh, look out, huh?
There you go. And Brandon Marcus, thanks for being with us today.
No problem. So again, I'd just like to
Sure.
go over our locations. We do have 4 offices. Kind of starting north, we have an office in Woodburn. It's located on 685 Evergreen Road, and just off the freeway there in Woodburn. We also have our main office in Salem, and that's at 1430 Commercial Street in southeast Salem. And we're here in Albany as well at 1390 Waverly Drive in Albany, Oregon. And we do have another office in Corvallis, which is at 1220 Northwest Kings Boulevard.
Okay.
And the phone numbers. The local number is 541-967-8385, and our toll-free number is 866-599-DERM. And just remember, here in Albany, it's the old library building right on the corner of 14th and Waverly.
The website is www.silverfallsderm.net, and we have some interesting links on there about some of the things we do, and we also have a list of the providers with their pictures, so people can check us out and see the addresses as well.
We don't put my picture in there under administrative.
That's right.
Oh, you look good there, Cajun Joe.
Well, they told me he had a face built for radio, so I guess that has something to do with it.
So we're going to post this on our KGAL website, kgal.com. We'll also post a link to the previous show we did September 13th, when we had Dr. John's wife in here, and we did a close-up on her face, and she'd had the L-therapy treatment. So if people want to watch that again, it'll be on our website today, companioned with today's show. So thanks for being with us on Skin Talk today. Don't forget, tomorrow it is From the Sidelines with Radio Ray, and be listening for promos on future Valley Talk shows. This is Skin Talk. I'm Dave Adams, Dr. John Young, Brandon Marcus, and Cajun Joe. Thank you for being with us today. We will see you a month from now, next second Thursday.
Bye, everyone.